Bleeding control and use of a tourniquet and topical hemostatic agents. Step 1. Wear appropriate protective clothing. Step 2. Explain the procedure to the patient.
Hi sir, I'm going to address your wound on your leg.
Step 3. Bleeding control with the dressing. Expose the bleeding site. Apply direct pressure over the wound with a dry, clean dressing. Keep pressure on the wound until bleeding stops. Apply a bandage to take over pressure on the dressing. Stretch the bandage enough to control bleeding. Ensure that if you are able to palpate a distal pulse before applying a dressing, that it is still palpable on the injured extremity after applying the dressing. If the bleeding does not stop, apply more pressure without removing the soaked dressings. Elevate the limb above the level of the heart if no fracture is suspected. Step 4. Application of a commercial tourniquet. If the bleeding cannot be controlled by direct pressure and dressing, apply a commercial tourniquet. Hold pressure over the bleeding site and place the tourniquet just above the injury.
The tourniquet should be placed 5 to 6 centimeters above the injury.
Click the buckle or tighten the Velcro into place and pull the strap tight. Turn the tightening down clockwise until pulses are no longer palpable distal to the tourniquet or until bleeding has been controlled. Application of an improvised tourniquet should you not have access to a commercial tourniquet. Removal of the tourniquet in this instance are for demonstration purposes only. Application of an improvised tourniquet. Fold the bandage 10 centimeters above the wound. Tie the ends of the bandage around a stick. Turn the stick to tighten the tourniquet. Continue tightening until the bleeding stops. Secure the stick with the remaining bandage. Step 6. Limb assessment and documentation after tourniquet application. Record the exact time, hour and minute, that tourniquet was applied on pieces of adhesive tape placed on the tourniquet. Inform receiving facility or crew handing over to about the tourniquet, and periodically assess the limb where the tourniquet was applied for pulse, motor and sensory function.
So can you feel this?
Step 7. Use of topical hemostatic agent if tourniquet ineffective. Uncontrolled bleeding with tourniquet and or direct pressure, or bleeding in an area where tourniquet cannot be applied. Apply hemostatic agent directly to the source of bleeding. Apply pressure with a dressing, either gauze or trauma dressing. Compress the wound at the source of the bleeding for at least 2 minutes. Evaluate for cessation of bleeding. If the bleeding has stopped, dress the wound appropriately. However, if the bleeding continues, reapply hemostatic agent and ensure direct pressure is applied with the dressing over the source of bleeding. On the note of the tourniquet, never use a wire, rope, belt, or any other narrow material as a tourniquet. This could cut into the skin. Also, never cover a tourniquet with a bandage. Tourniquet must be left open in full view.